Hello and welcome. Thank you for joining me on this mini masterclass for thyroid dysfunction. I'm Dr. Pranav Vyas. I'm going to be a presenter today with this. I am a functional medicine practitioner and I've been practicing for over 18 years. And in these, we've helped thousands of patients recover from any kind of thyroid condition. So we will talk about what exactly this whole hypothyroidism is, what causes it, and what you can do to help even reverse this condition. And trust me, it is reversible. So let's get started with some of this information for you. So thyroid dysfunction, in my opinion, is one of the most poorly managed conditions in all of healthcare, along with diabetes, right? Because what's happening is they're more fixing it with chemical cover-ups. They give you a pill just to kind of help bring your numbers in range, and then they leave you there, right? But some people still experience a lot of symptoms from that. So we're going to talk about exactly what's going on and what you can do for your thyroid condition. So you are here because you've been diagnosed either with a hypothyroidism or maybe you have some of these symptoms and you're wondering what exactly is going on. So I will talk to you about low thyroid condition symptoms. So the first is no energy. You end up with weight gain. You notice things like your hair is thinning. You have chronic fatigue. You sleep well or you think you're sleeping well, but you wake up in the morning and you're still very tired. You get foggy thinking because of that. You end up with low libido. That is low sex drive, anxiety, depression issues. Those are huge with people. Cold hands and feet, right? Your thyroid is your fire, is the one that drives the fire in your body or your metabolism. And that's one of the big reasons why a lot of people end up with cold hands and feet all the time. You get muscle aches and pains. You even end up with elevated cholesterol levels. So I'll talk about a few statistics about the thyroid. 1 in 8 women will develop a thyroid disorder in her lifetime. That's some staggering numbers, right? And that's adding up to close to 20 million Americans have a thyroid condition. Now, yet 60% of those will not even know that they have the condition because, again, a lot of symptom cover-ups, right? You're giving some medication and you think you've solved the problem, but you still have this underlying cause of that whole deal. And that is what we try to do as a functional medicine practitioner. We'll talk about some of these things later. But what we like to do is we like to find the root cause of a problem. Let's talk about that. Now, women are 5 to 8 times more likely to develop a thyroid condition than men. And that, again, it's not just because it favors it because of some reason, but women are more sensitive to a lot of hormonal changes in their bodies. So that's one of the big reasons why you notice this more in women than in men. So again, we talked about some of these thyroid statistics. Undiagnosed thyroid disease may put patient at risk for a lot of different serious conditions, such as your cardiovascular disease, osteoporosis, infertility issues. That's one of the big reasons why a lot of people are tested when they're trying to get pregnant or they are pregnant. They test their thyroid hormone first because a lot of times all these things play a major factor in a lot of things. And if you, again, leave some of these things undiagnosed, in serious cases, you can even lead to death. So that is not a good thing there. Now, why and what is going on with all of these? Let's talk about this. 90% or 9 out of 10 cases of hypothyroidism is not even because of your thyroid. Sounds crazy, doesn't it? So 90% of the cases is because it is a problem with your immune system. Hypothyroid conditions, also known as Hashimoto's. Hashimoto's is an autoimmune condition. This is where your immune system is attacking itself or is attacking the thyroid. And that is what's leading you to end up with a lot of these thyroid symptoms. Let's go on. So I'll give you a little bit of a basic physiology of how the thyroid functions, right? So in our brains, we have a center called the pituitary gland. This is also known as the master hormone gland because it controls the release of every hormone you have in your body. So the pituitary gland signals or sends out a hormone called TSH, which is your thyroid stimulating hormone. This is something you may be familiar with because these are certain things that are tested on blood work. We'll talk about some of this blood work in just a little bit. So the TSH comes to the thyroid and stimulates the thyroid to produce T4, which is one of the thyroid hormones, and a little bit of T3. So from your thyroid, you get about 90% of T4, that's the thyroid hormone, and about very little bit of T3. Now, T4 that's produced by the thyroid is in its inactive state. That means it's not going to cause any functional things in the body. It has to be converted into its active state, which is your T3, and most of that happens in your liver. 60% in your liver, 20% in your gut. So it makes sense that your liver and your gut be playing, working well for it to be converting this into the active state of T3. Now let's talk about some of this blood ranges. When you go to your doctor and they'll order some blood work, these are some of the numbers they're looking for, is the TSH, T3, and T4. You might have seen those things. Now, TSH, your thyroid stimulating hormone, has a range of 0.45 to 5.5. This is a large range. As you can notice, 0.4 or 0.5 to about 5.5. Significantly big chunk. Now, if you're a little less than 0.45, you're considered in the disease state, right? That's when your thyroid is not functioning well. Or if it's a little too much, more than 5.5, again, it's considered a disease state. Your thyroid is not functioning well. But what we look at in functional medicine, or as a functional range, the optimal range for your thyroid to be functioning or for your body to be working or expressing itself fully is between 1.8 and 3.0. So that's about this small, narrower range. You see this smaller range right here? That's considered the optimal range. So you could still be in here. Yes, your doctor may give you some medications. Again, that's what conventional medicine does, is if you fall in any of this disease state, they put you on some medication that will help you bring you a little bit back into the normal ranges, as they call it. Now, even though you're here, say you have your range is at about 1.5. Well, for some people, they may still be exhibiting symptoms. You may still have thinning hair. You might still be gaining weight. Your energy levels are still low. That's why we look at what we call this optimal ranges. That's what the range where your body is working optimally. So we want to make sure you're functional there, not just in the so-called normal ranges. So again, as we just mentioned, that 90% of thyroid conditions or hypothyroid conditions are immune related. So does it make sense to look at the immune system? Well, this is where some of the conventional medicine falls short again. A lot of times they do not order this following test. There are two other tests that can be ordered for the thyroid that show what is going on with the antibodies or your immune system. The first one is called TPO, your thyroid peroxidase. Now, these are one of the antibodies which should be less than 35. This will show us if your body or your immune system is attacking the thyroid. Same as something called TGB, or your thyroglobulin antibodies. Thyroglobulin is a protein which kind of helps transport the active, the T3 throughout the body. So if you have an issue with that, if your body is producing antibodies against that protein, your body is not functioning well. Now, again, that should be less than 20. We've had a lot of patients in our office who have TSH levels that say are falling between the normal ranges. But when we've tested the TPO or the TGBs, we had a patient who had TPO levels. TSH levels were normal, but TPO levels were in 1,000. Even we've had some with 2,000. Now that is significant. That's telling us that the body is really attacking the thyroid, even though the thyroid's TSH levels are normal, because that's a brain connection with the thyroid. Your body itself is attacking it. So we need to really pay attention to some of these numbers because they give us a much better understanding of what's going on with the body and your thyroid itself. Now, a lot of these numbers can be elevated for years before your TSH numbers or your TSH values even change. So that's another thing that we need to look at. So yes, you may be having a few symptoms. Maybe you're not diagnosed fully with hypothyroidism, but if any of these numbers are off, you are down the path to developing some kind of hypothyroidism. Now, so in order to get truly well, we must fix the immune system. We have to address the immune system. I just showed you hypothyroidism and your immune system are closely linked with that. So what happens? Let's talk about some of these factors right here. So I'm going to talk about a few things here. These are the other factors that affect the thyroid itself. Now, I'll tell you one thing. This is one takeaway. If you don't take anything else away from this, the one thing is your thyroid cannot primarily dysfunction on its own. It's not going to just wake up one day and say, hey, we're not going to function. There are a lot of different factors that lead to the thyroid not functioning as well as it is, or making the thyroid not functional fully, optimally, as we talked about. So let's talk about some of these things. So your T4, for your body to produce enough T4, you need to have certain nutrients in it. We are all familiar with iodine. You know that iodine is a huge nutrient that's required by the thyroid for it to produce T4, your thyroid hormone. Now, iodine is just one of them. Tyrosine, zinc, selenium, vitamin E, your B vitamins. There's so many other small nutrients that are required by your thyroid for it to function or for it to even produce your T4 levels. Now, as we know, from T4, it's converted into the active T3 state. There is also this other one. You'll notice this guy here. It's called reverse T3. Reverse T3 is also produced when it's a what we call a feedback mechanism. When you have enough T3 in your body also produces reverse T3, which sends messages back to the brain and tells it, hey, we've got enough of this, don't produce any more. There are certain times when your T4 can directly be converted into something, this reverse T3. Things like stress, trauma, low-calorie diet. Well, a lot of times people are following a lot of these yo-yo diets or low-calorie diets to kind of keep the weight off. But what these things are doing is they're actually, instead of allowing T4 to be converted to T3, they convert it into reverse T3, which blocks the production of more of the active T3. A lot of factors there we see, right? There's inflammation. We'll talk more about inflammation, toxins, infections, a lot of medications also. Most of the synthetic medications actually have tons of side effects. We are all familiar with those side effects. One of them is that it can make this more of this reverse T3. Now let's talk about your levothyroxine or your Synthroid, your artificial or your synthetic T4. That's what they are. They are synthetic T4. So even though they're giving you a synthetic T4, if you don't have other nutrients or you don't have the right mechanisms to convert it into T3, well, your body's not gonna respond to that, will it? So they can give you enough of that higher doses of your levothyroxine, but your body says, hey, we don't know how to convert that into T3, so we don't know how much to use, so you're only using a little bit of it. So it might manage a few symptoms, but it's not correcting the problem, is it? That's what happens. So selenium and zinc, these are two main things that are required for T4 to be converted to T3. So again, if you're deficient in a mineral, you might end up with some issues from there as well. Now, every cell in our body, from your hair, your nails, your kidneys, your muscles, all of these have receptor sites for T3 and reverse T3. Every cell in our body has a receptor site for T3. That is what it does. So your T3 has to come and bind to a cell. When it does, it's what allows the cell to function the way it should. So that is what you have to take away from this guy as well. Now, cellular health is also very important in all of these things, right? We have a healthy cell right here. Now, when your cell is healthy, it's able to take oxygen and nutrients into it and, use them and produce some waste and get rid of those waste. When we end up with what we call cellular inflammation, we're going to talk about cellular inflammation in just a little bit. This is what disrupts the cell wall. So the cell wall, which is again the outer covering of the cell, is very important. If that gets disrupted, you don't have enough, or the nutrients don't pass through enough or the way they should. And that causes the cell to start not working as well. It might even end up with premature death of the cell. Now, as I mentioned, every cell has a receptor site for T3. If your cell wall is disturbed or disrupted, this T3 cannot bind to this thing, can it? And then you end up with the way I said, your cells don't function as well as they should. Now, what causes all these issues? Toxins, sugars, the bad fats, your standard American diet. Our diet is laden with high amounts of sugars and the bad fats and all these things. That leads or adds to cellular inflammation. And that can cause all sorts of these other issues. Stress is another major factor. We're talking about stress just following up right now in just a bit. Now let's talk about these toxins first. I read this thing which was also very shocking for me. I just pulled this information out of a website online. It says the average woman puts 515 synthetic chemicals on her body every day without knowing it. That's a lot of chemicals, from your shampoos, your conditioners, your makeup, the lipsticks, the perfumes, all these things that we're putting on our bodies are all synthetic chemicals. They're all synthetic things. And again, we know that anything that we put on our skin, what happens? Your skin is porous. So about 60% of what you put on your skin gets absorbed into your body. And then it causes all these other toxic and crazy effects in the body. Now, this is another crazy fact. It's estimated that we are exposed to over 700,000 different toxic chemicals on a daily basis. Your GMOs, the gas fumes, your toxic fumes that are coming out from exhausts of cars, all the stuff that they're spraying in the airs, all that stuff comes into our bodies and creates all this, toxic overload. So now we talk about another big factor here, and this is your inflammation. Inflammation, it is at the root cause of every chronic condition that we know. Your heart disease, cancer, diabetes, all these things have been linked back. They say 7 out of 10 of the main leading causes of death or chronic illnesses in America are caused by inflammation. So we need to pay a little more attention to this inflammation. And that's why I said, is your bucket overflowing? Our buckets are definitely overflowing. We just talked about the toxins we're being exposed to, the infections, the foods we're putting in our bodies. They are all leading to this inflammation. It causes things like your blood pressure issues, your digestive issues, weight trouble. We're all familiar with a lot of these things. Inability to handle stress, fatigue, headaches, brain fog, depression. All these conditions are being led by all the stuff that we are putting into our bodies, which is leading to inflammation. Itis, if you've ever been diagnosed with any kind of itis, right? Tendonitis, gastritis, thyroiditis, these are all inflammatory conditions. And again, the way I said, chemical strain, toxin strain, all this stuff that are coming into our bodies, from the diets we're eating, these are causing our bodies to add to this level of inflammation, causing all these other problems that we're experiencing. So here we go. I love this picture because this is saying that a thyroid condition, as I said, is not primarily your thyroid just underfunctioning or not functioning as well as it should. There are lots of major factors that influence the thyroid. Let's start with this one. We talked about autoimmunity. If you have certain issues going on, which are causing your immune system to attack the thyroid, the autoimmune conditions, that can make your thyroid not function well. A sluggish liver, 60% of T4 is converted to T3 in your liver. So if your liver is not functioning well, you end up with this. Now, something called estrogen dominance. This is all related to hormones. We're going to dive a little bit into the hormone part because, again, your stress hormones, your sex hormones play a very integral part on how well your thyroid functions. Low stomach acid. Now, this is something, how many people are on stomach reducing or stomach acid reducing drugs? Your Pepcid AC and your omeprazoles and all these. When you reduce the stomach acid, a lot of things that are supposed to happen don't happen right, and your thyroid suffers from that. Leaky gut syndrome. This is a term that is being used, you'll hear a lot about nowadays because leaky gut syndrome is becoming the leading cause of immune conditions, but also all sorts of inflammation in the body. Leaky gut, well, when we are putting all these foods that are laden with toxic chemicals and preservatives and dyes and all that in our body, that produces a bit of a strain on your digestive system. Now, another big factor, 80% of your immune system lies in your gut. If your gut is not happy, you're not going to be happy. Not just the immune system, a lot of the neurotransmitters. You may be familiar with something called serotonin. Serotonin is something that helps your brain calm down. About 70% of serotonin is produced in your gut. So again, if your gut is not happy, we say your body's not going to be happy. So we address some of these leaky gut issues. Food sensitivities, food intolerances. We test for food sensitivities because nowadays, the way I said, this GMOs, the artificial chemicals and preservatives that are put on foods, when you put some of those things in your body just says, we don't know what this is. It considers it foreign and launches an immune response towards it. So we need to make sense for us to address food intolerances and sensitivities. And then we'll talk about adrenal fatigue. Your adrenal gland is your body's stress handling organ. This is what produces cortisol or all sorts of adrenaline, right? These are stress handling hormones. We are always in what we call the fight or flight mode. We're always loaded with stress nowadays, and our bodies are always like this. That causes a lot of production of cortisol. We're going to talk about that in just a second here now. So let's see what causes most of these things. We just talked about diet leading to this thing. Inflammation is adding to all this stuff. Stress will lead to your thyroid not functioning well. Toxins, we said that, and hormones. We'll dive a little bit into some of these things, and I'll show you what exactly is going on with this stuff. So stress. Who does not have stress in their lives nowadays? Now, when I talk about stress, people always think about emotional stress and, those kind of stressors. There are lots of different stress our body faces. Chemical stress, as I mentioned, from the foods we're eating, that can load, put more of a stress on the body. Temperature is a stress. Emotional, physical, psychological, so many different stressors that we're loaded with on a day-to-day basis, that your body goes in always in that fight or fight mode. Flight or fight mode is producing something called cortisol. Now we're back to this. Your brain, again, the way I said, your pituitary, your hypothalamus is a section of your brain which signals the pituitary to produce or stimulates, called your adrenal cortex, to produce cortisol. Cortisol is your stress hormone. Now, I won't bore you with too much of the science here, but a lot of these processes in between, there are chemicals and hormones that are produced, which will actually stop your TSH production. Same thing with cortisol. You have too much stress, you have too much cortisol in your body, will stop. So stress inhibits the production of TSH and the conversion of T4 to T3, as you can see right here. So again, makes sense that we need to address that level of stress. So that's one of the other things we do in our office is we check. We don't always, just go from symptoms. We love to test. We have a saying in our office, we don't guess, we test. So we will actually test your cortisol levels. We check to see where your stress hormone levels are, because that'll give us an idea of what else is going on throughout the body. Now, this is another fun, interesting factor right here. Hormone symptoms overlap. We talked about the symptoms that we experience when you have hypothyroidism. Now, if you have too much stress, when your body's in a stress response, too much cortisol, these are some of the symptoms you experience. Weight gain, the midsection weight gain that people notice, muscle aches and pains, thinning hair, fatigue, anxiety, depression, low libido, and a little bit of blood pressure issues. Now, that's kind of sounding a little similar to what your low thyroid symptoms are, aren't they? Well, let's go on. When you are in what we call estrogen dominance, high estrogen levels. So let me address one small thing. I always get, ladies that come into the office, I love showing them this kind of deals because this actually addresses a lot of those symptoms. If you're menopausal, you would think that your estrogen levels are low, right? Because that's what you've been told, that, hey, estrogen levels are low. But what happens? When you're menopausal, a lot of times people have gained weight, right? These fat cells that you have in your body are a huge estrogen producing factory. When you have a lot of fat cells in your body, they're actually producing estrogen. So even though your ovaries are not producing estrogen, we've had people with hysterectomies that still have something called estrogen dominance. Full hysterectomy where your ovaries are gone, but you still have a little estrogen in your body because your fat cells, the adipose tissue, produce estrogen. So we need to address that now. Progesterone is the other hormone, other sex hormone that helps balance the levels of estrogen in your body. But when you have enough of estrogen or too much estrogen, the progesterone cannot balance it out and you end up with this whole estrogen dominance that I'm talking about. What are the symptoms of estrogen dominance? Weight gain in your hips and thighs. Some people can relate with this thing, right? Fatigue, mood swings, anxiety, depression, low libido. All of these deals are, again, sounding very similar to what you have with your thyroid condition or your cortisol condition. So again, if you say you have some weight trouble or you're having fatigue issues and you go to your doctor and they say, oh, it's your thyroid, let's address that. They may put you on a synthetic hormone, your levothyroxine or Synthroid. You may get a little relief for a while, but what happens? You still end up gaining weight or you're still ending up, tired, mood swings. Because again, a lot of these things have not been addressed. I call this my three-legged stool. Your thyroid, adrenals, and your ovaries or your estrogen levels all work in conjunction to each other. They're part of the endocrine system. This system functions and dysfunctions as a family. I like to say that because if one of them is not working well, your body will try to rev up some of the other ones, kind of balance certain things out because your body's always looking for that balance, right? So it's going to try to balance those guys out. And if it cannot do that, well, it's just going to comes back out of balance again. So we need to address not just the thyroid. If you have a thyroid condition, we need to address your stress hormones and your sex hormones because those are all what cause this whole homeostasis or balance in your body. So again, conventional medicine does not address that. And sometimes that's where they fall short because symptom fixing. They're just trying to cover up some symptoms with some chemicals. So it doesn't always work with that. Now, so the big question in all of this thing is, are you sick and tired of being sick and tired, right? You've been waking up in the morning, you have this tired feel. You may think you're sleeping well, but you wake up in the morning and you still feel exhausted, and you're tired of getting this medical runaround, right? From specialist to specialist. You go to one doctor, they suggest you go see an endocrinologist, you go somewhere else. So half the time, most of the patients I see in my office have at least been to about 5 or 6 different doctors before they come to me, right? And again, it's getting tiring. You just get tired of getting too much information and just not enough help. Now, are you also sick of this information overload? Well, I know we love Dr. Google. Everybody loves to go onto Google and type in some symptoms and see what pops up. And then you get all sorts of information from it. Oh, you have this, you might have that. Try this supplement, try some vitamin, try an essential oil, something might work. Well, instead of all of that, why don't we just try and personalize a treatment protocol for you? This is what we do with functional medicine. As I mentioned, in functional medicine, we dig deeper. We're going to look to see what exactly is causing your hypothyroidism, as in what is causing your body not to allow the thyroid, or what your symptoms are stemming from. So what I have to say, or what I like to say in the office is, if we find the root cause of a problem, the symptoms take care of themselves, or the symptoms will correct themselves. So that's what we like to do. We like to personalize this program for you to find out exactly what's going on with you, and then help correct it from there. So if this is you, I have a special opportunity for you. I am offering a cellular health analysis and a case history evaluation. This is where I'll sit down with you and talk to you and understand what's going on. Because again, the conventional medicine falls short in this thing. They're not looking at your nutrition. They're not looking at your lifestyle. Do you exercise? What have you done so far for your health? Are you on some form of diet? These are all factors that can kind of influence your whole overall health, as I just showed you, right? So there's a lot of things that a whole very in-depth history can give us an idea of exactly what's going on with your body. The next thing is, we're also going to provide you with an at-home cellular health test kit. This is something we're going to send over to you in the mail. It's a simple urine analysis. You're going to you pee in a cup, we'll test certain things, and that'll show us how your cells are functioning. This test is 50 times more accurate than any blood test and can tell you your true cellular health. As I said, with all the toxins and the oxidation that's going on in our bodies and all that, is causing a lot of our cells to age prematurely, the premature cell death. So this is something that will give us an idea of what's going on with your cell health. And the last thing we'll also throw in is an inflammation questionnaire. As I mentioned, inflammation is at the root cause of every condition that you can imagine right now. So it makes sense to address your level of inflammation as well. And this questionnaire will help evaluate how much inflammation is going on, or what can be causing all this inflammation that you have in your body. So it's an amazing questionnaire. It's a few pages, but it'll show you your diet, your lifestyle, what's going on, and what's causing some of this inflammation in your body. Now, all of this thing is at a $441 value. Just because you stuck around with me and you're hanging on and you wanted to learn more and you're ready to take maybe the next step, as in finding out more of what you can do to help fix your health, we are offering this at just $97. So at $97, if you sign up in the next step, we'll take you and we'll show you how I can sit down, or, we'll communicate through this thing. We'll send you out the test kits. If we need to order more testing, or if I need to do any more testing, we will actually send some of these test kits directly to your home. This can be done at home. You send the kits out directly to the lab. We get the results, and then we'll sit down and discuss these results over, one of these kind of devices, or over the phone call. So we can talk about all these things, because again, that's why I say our protocol can be done from anywhere. I've been doing this for 18 years now. And we've seen amazing results, and this protocol is amazing. If we find out the root cause of your problem, we can personalize a treatment plan for you to show you how your body can correct and get to where it's supposed to be. So let me say, there's just one rule I like to put with this thing, right? I'm offering all this stuff, but there's one rule. You really need to be ready to get some transformation. Now, hypothyroidism or any of these conditions you had did not just happen overnight. This is something that, developed through years and years of maybe diet and what you have been doing to your body and all that. So we are going to take all of that and kind of bring it back into correction. It takes a little while. So you got to be ready for these things. Yes, from some of the maybe the food sensitivity testing, if we say you need to avoid dairy, you need to avoid gluten. Gluten's a big thing that comes into some of these deals. You need to be ready to do some of that. If you're ready to do this, trust me, this thing works. We have helped thousands of people reverse hypothyroidism, bring your levels, not just your levels, your symptoms, your whole body. It's a full body transformation. So if you're ready for this thing, let's do the next step. And I'm looking forward to talking to you. We'll sit down. As I mentioned, it's a personalized program. It is designed specifically for your needs. So I hope some of this information has helped you. And if you've taken a few, takeaways, hey, at least I've helped educate you on what's going on with your body. So hope this has helped. Let's get in touch, and I'm looking forward to talking to you. And then we'll go and see how, we can help you with all this stuff. Thank you.